हेलो गाइस, वेलकम बैक टू माय चैनल। आज आपका फिर से स्वागत है मेरी वीडियो में। आज मैं आपको मिलवाऊंगा मेरी यूनिवर्सिटी के इंटरनेशनल डिपार्टमेंट्स के हेड से और साथ के साथ डीन से भी। तो आइए बने रहिए मेरी वीडियो में, मिलते हैं आगे। So today we have educational head of our university, and he teaches also hygiene, and he is in hygiene department also. So I will ask a few questions about our university from him. So sir, my first question is that can you tell us about the English speaking fluency of the university teachers, and how does the university ensure that international students are able to understand and communicate with their teachers effectively?
Okay, thank you for the interesting, very famous questions. First of all, I must say that we have English program from first to sixth course, so all period of your education at our university, an English program, general medicine, dentistry, and pharmacy. You will teach on English language, and that's why quality of educational process our teachers are very high. That's why we try to find personally a teacher for international students who will study with our international students on English program. Our teacher every year improve the English knowledge. We organize special English course every year with a special language speaker from different countries and from our country to improve English knowledge. And I think that students who study at our university have a good knowledge after all our subjects, especially subjects, very necessary subjects as anatomy, pathophysiology, pathology, and especially subjects of practical training when our students go to the clinic and try to get many useful information about practical skills and take some more information from our teachers, can do it after lessons. And if we have our teacher have free time for the students after the lessons, they can discuss some problems which we discuss on the lessons. But we know that our lessons have a small period, and sometimes students ask many questions, and that's why after the lessons our teachers try to speak with the students and to describe any situations, clinical situations, or maybe pathology situations with students, and to improve practical knowledge for our students. So I think that we have no any problems with communications between our teachers and students.
अब जैसे कि बहुत लोगों को डाउट है मेरी यूनिवर्सिटी का क्लिनिकल और प्रैक्टिकल एक्सपोजर नहीं है। बहुत लोग ने मेरी वीडियो पे भी नेगेटिव कमेंट्स करे थे, तो उनके लिए भी मैं ये एक क्वेश्चन पूछना चाहूँगा सर से, तो सुनिए आगे वीडियो में। सो नाउ सर, माय सेकंड क्वेश्चन विल बी अबाउट clinical and practical exposure of our students, which students receive during their time at the university, like cadavers and these things stuffs.
Yes, first of all, I must say that after the first course, our students had special practicals knowledge in the hospital, because we have some subjects, for example, practical subject nursing, anatomy classes, when the students can have some practical skills, such as a class of anatomy. We have own cadaver center, and in this cadaver center the students can learn anatomy using body of human body.
Yes.
It's very necessary to learn anatomy, histology, pathology using cadaver material. But another way of studying which we use at our university is anatomy table of Pirogov. This table is our own product, which was product at our university by our scientists. Anatomy, they learn two parts of human body using electronic device, VR technology, and the second part is cadaver material. That's when we combine two way of learning of anatomy. It's very good. And at our university we had a cadaver center, and so our students who learn anatomy, pathology, and other clinical subjects can learn it using by modern IT technology. It's a table of Pirogov, which was produced at our university, and another side of learning anatomy and another clinical practice, it's using cadaver material. It's our cadaver center. That's why it's improve our knowledge.
तो जैसे कि आपको पता है इंडिया में एक क्लास में 100 बच्चे बैठे होते हैं और एक टीचर उनको पढ़ाने वाला होता है। ये चीज़ रशिया में नहीं होती है। तो मैं आपको अभी अपने यूनिवर्सिटी के इंटरनेशनल हेड से ये चीज़ क्लियर करवाता हूँ, कंफर्म करवाता हूँ कैसे यहाँ पर बच्चे पढ़ते हैं और समझाएंगे वो भी आपको। So sir, as in India, like so many students sit in a single classroom, like 100 students sit and one teacher teaches them. But here in Russia, as I can see, like there are 15 students in a group and a single teacher teaches them. Like, so how is this beneficial for Indian students? Can you tell?
Yes, for our Russia educational system of higher medical education, so we have very good experience to teach medical future medical specialists, and we try to combine not many students in one group, about 30 or 15 students in one group. And that's why it's very good to communicate teacher and to explain, because every students from this small group can ask the questions to teacher, and if the group are very big, for example more than 100 students, it's difficult to communicate, and many students from this group can't ask the question for the teacher. And every after classes and cycle, we have a small control exam, for example, to check what knowledge our students took from our teachers. And if the teachers see that students show not very good knowledge, they try to change the situations and to explain more information to improve the medical knowledge, because after the end of the course, students will send the exam. It's very necessary to check all period of education and to prepare for the exam. And that's why I think that in Russia Federation the system of high medical education is very good, because we have small group and we have many control after the classes, after the cycles, after the semester, when the students can take the exam.
So now I am going to ask about international accreditation of my university to the international department's head. बेसिकली होता क्या है, आपकी एक्रेडिशन और आपका जो सर्टिफिकेशन होती हैं बहुत सी, आपको जब बाद MBBS के बाद जो एग्ज़ाम्स देने होते हैं वो बहुत इंपॉर्टेंट होते हैं। तो वो मेरी यूनिवर्सिटी की कैसे हैं वो सर आपको बताएंगे, और इंडियन मेडिकल स्टूडेंट्स को क्या क्या बेनिफिट्स हैं, क्योंकि मेरी यूनिवर्सिटी की पार्टनरशिप है। सो नाउ सर आई विल आस्क in the last, like, benefits for Indian medical students, as our university have several partnership programs with prestigious Indian medical colleges, and about ECFMG certification of our university.
Yes, our university was accredited on international accreditations of standard of WFMA. And that's why all our students who was graduated at our university with our diploma can go, for example, to America, to another country, and to pass the exam of CFMG. It's very necessary for them, and that's why it's one of the reason to choose a university with international accreditation. And our university had accreditation of program general medicine, dentistry, pharmacy, and so on. And we have many partners, more than 32 partners, official partners of our university, and 3 partners are from India. One of the partner is AIMS University, the second is KGMU, and the third is the Symbiosis University. With this university we have a good relations, we get good partnership. This university communicate with our university to change the different technology, and our university give them technology of VR technology and technology of anatomy table, and some of this university bought our product and use its product in educational process in this university. And I think that's why our partner communicate with our university to change different technology. First of all, we take, for example, VR technology, anatomy table, and gave this technology to this university to improve the educational process. And I think in future we will have more partners from India to collaborate this university.
So, sir, another question for you. What kind of support does the university offer to its international students, both academically and personally?
Yes, we have a lot of international students at our university, but if the students have some problem with educational process or with dormitory, they can go to the dean office and try to decide this problem with head of the department or with the dean of the office. And we must say that in our dormitory we have a specialist of our department who on the base, on the place where our students live in, can try to decide the problem with different side of students' life, not only with subject problem, educational problem, but with problem which can appear during all life, students' life of our international students. And in this side, I should to add very useful information about practical base of practical skills for our students.
Yes, sir. This is like the most important question.
Yes, because I know that it's difficult to prepare medical students only using book, because book it's only theoretical material. But if you want to take many practical skills, you should go to the bed of patients and try to communicate with our patients, and we can take this opportunity for our students. We have our own clinic. The clinic of Samara State Medical University is a very big hospital, more than 1,000 beds, and with different departments, and students can go to the department, for example, surgical, therapeutical, obstetrics and gynecology department, and to learn a disease of the human body, not only on book. They can learn this disease to communicate with patients. It's very good process, educational process in medical university, and at our university you will have a good this opportunity. But if you want to have a practice in another site, for example in India, we can take this possibility for you, because we will in future we will have a contract with hospital in India, and if you want to take some practical skills in hospital in India, you can do it. But for these situations, you must go to the dean office and say that you want to, for example, in summer, when you will have a summer holiday, to spend your free time in your country, in any hospitals of India, and we try to help you.
Yeah. Thank you so much, sir. It was very well explained. तो अब जैसे कि मैंने अपनी यूनिवर्सिटी के इंटरनेशनल हेड से बात करी, अब मैं आपको मिलवाता हूँ डीन से और पूछता हूँ क्लिनिकल्स और हॉस्पिटल से रिलेटेड कुछ क्वेश्चंस, और उन लोगों के लिए भी क्वेश्चंस जो मेरी यूनिवर्सिटी के बारे में नेगेटिव कमेंट्स फैला रहे हैं. So now we have respected Dean of Samara State Medical University. So sir, I want to ask you some things related about our clinical exposure in the university. So what are your views regarding this?
Hello guys, my name is Dr. Andrei and I'm the Dean of all international students in Samara Medical University. What about our clinic? So we are one of the most famous medical university in Russia who has their own clinics. It's really important we have our own clinics, and it's a good benefit for the students because you will have the opportunity to work with the real patients from the first course. Our clinics is well equipped, so we have good equipment, good tools, different departments in different fields of medicine, so therapy, surgery, neurology, obstetrics and gynecology, etc. So you will see all these departments and will work with all these teachers and patients. By the way, we have the excellent cadaver centers. So those students who want to become the surgeon, for example, will be able to work with the cadavers in our clinics. So we have good teachers, and they both make the scientific work. They teach the students, and also they work with the patients, so they treat the patients. And if you want, you will be able to work with them in daily manner every day. What else? So our students start work in the clinics from the first course, and every summer we have the summer practice. During this time you'll be able to work in different departments as you wish with the doctors. And those students who want to make the deeper knowledge will be able to work with the teachers, with the doctors in the clinics as well. So practice from the second course. Teachers are open to communicate with the students, and we have the teachers in our departments who speak English really well. And if you want to work with them, if you want to make the scientific research, of course, all these opportunities are open for you. So, briefly, it's the most important information about our clinics and our university.
Thank you so much, sir, for your this explanation.
Welcome, and we hope to see you soon in our medical university, Samara State Medical University, and we hope that you will enjoy to join us.
Thank you so much, sir.
You're welcome. Bye.